Good morning. There's just a little bit of morning left. But I did say I was going to give you an update and I didn't do it. So here it is. And I should have recorded it. I mean, she gave me permission to do that before, but I've since forgotten about doing that. And I really wish I would have, because you can go back and get a fresh reminder of what she said. She said some things that were kind of important, and I should have had her elaborate on those things, and I didn't have my questions like about that part in front of me. What am I trying to say? These were different scans, and as far as I know, I'm doing well, but I think I could have got a little bit better, a little bit more information than I did. Because she said that it's still showing, okay, right here between my breasts, but down in deep between my lungs, there is a small mass, which is, she says she thinks it's lymph nodes, okay, because we have lymph nodes. And then she said something about down here being some soft tissue, and I'm not sure what she's talking about there. But I wish I would have asked her more, because when they did that, they did one scan anyway, they had me turn my head. So they were imaging my skull. But she didn't say anything about my skull, so it must be okay. All I know is, let's see, what was good about my update. I don't know, because we discussed my hot flashes are back with a vengeance. So medication she gave me before that I did not take because it was so expensive. She told me to start taking that, which is geared specifically for hot flashes. So I'm going to do that just to see if it works. But sometimes these medications have to be in your system for a while before they work, so I'm not sure. I have questions. She's going to be gone on vacation when I go back in there next week. I won't be talking to her. So my blood sugar's up according to the blood work. But see, I might have had a little sip of something that could have changed that. Also, it could just be up. See, I think she said it was 220. But when I went in for my blood work, it might have been, like I said, after I had something to eat, which would throw things off. But still, it probably is right around 200. And I've got to not be drinking the coffee with the creamer, which I have started doing again. So I'm a bad girl. And I haven't been eating right. And I know, it's my fault. It's my fault. But, I need to get back after that. So I can't even remember really what the update is. So far I must be doing okay. We want to get my blood sugar lower, and that's not really something that they seem to worry about, but if cancer loves sugar, then that is something to worry about, isn't it? And then high blood sugar is supposed to affect your heart too, or maybe your veins, all those things, your blood system. Is that a certain word? Your respiratory system is your breathing, but your blood pumping to all over your body and through those veins and vessels and whatever you want to call them, that's got to be a system too. Circulatory system, which one would that be? Would that be the blood not being able to get everywhere, give you what you need? I bet that might have something to do with it. Anyway, this is just going to be a short visit, and I thought I had more of an update. You would think that I would. I don't really know. I think they would have been um, more concerned if there was more problems. But then again, you never know if they tell you the truth. But I'm hoping. She's a really good doctor. I like her. But just because you like somebody doesn't. Like I said, different doctors say different things. So I think she did use the word little to no activity, cancer activity. And then I still have this mass, but that might be something that takes a while to get rid of. But it was small. It was a small mass, and she thinks it's a lymph node. And see, the lymph nodes are made to catch the cancer before it leaves the area. However, it's already in my bones. I'm just curious, so I really should call the office and talk to her nurse or something. So I need to figure out those questions and maybe call and see if I can't get some information before it's not fresh in their minds or something. There's so many cancer patients, so it's kind of scary, people. Hopefully everybody's getting what they need. And I haven't been using my ointment. I should have been doing that too. I guess I better get after that. And what else? Just need to eat good. Things that are good for me. And I need balance, I guess is what I'm trying to say. A protein, a vegetable, a starch. Or if you're going to have a starch, have a protein and a vegetable to go with it. Anyway, that's all I have to say at this moment in time. I will do something better after. It's going to be a cloudy day, but at least the temperatures are going down. They've been up almost to 100. And humidity, it just seems like there's been a lot of humidity. Maybe that's just the way it is out here. So, and it could be my hot flashes making me think it's humidity, because all of a sudden I will look down. It won't be that I'm just looking down, I will feel it. And then I will look down, and then I will see this sheen across my skin, which is water. It shows you. Yeah. Not a comfortable situation. But everything's groovy, baby. I go in for treatments, just shots, the shots in my buttocks. Next Thursday. They did not give me a schedule yesterday, and they said they'd wait until next week. Well, my doctor's going to be gone next week, so I don't know how that works. So I might want to put that down as a question, huh? What about my schedule? Because, see, there are these things that I forgot to ask, and I don't see an ink pen because I put it somewhere else. Anyway, questions I need to ask. We're doing one every 3 months for the IV. Oh, that is something she said. Not drinking enough liquid. So the numbers. Anyway, it's talking about kidney function and liver function. So I've got to either or. I've got to start really drinking a lot more liquid or just quit the IV. I mean, that's an option. So I'd kind of like to know how my bones are doing. If they could see healing in it before, is there still more healing? Or am I doing myself a injustice by taking these treatments and then not drinking enough liquid? It's important that nutrition is important too, and some people don't realize that. You know, you probably don't realize it until you get older. But hey, yeah, it's important. Which means you have to buy it and prepare it and eat it. The fruit, I guess you can just cut into it. But you don't always have a good choice of fruit, vegetables. The kind that are fresh from the garden type of deal. However, for my smoothies, I think the frozen fruit is best. I could be wrong. Depends on what they do when they're processing it before it gets frozen. But as far as I knew, it's getting harvested and cleaned and frozen. But they're also cutting those green things, the tops off in your frozen ones. So it's all on how you look at it. If you have something frozen, it can stay in the freezer. You don't have to worry about losing it because, I forgot it was in the fridge. And someone else has done all the work for you. So all you got to do is grab a little bit of it out and make you something. And that's what I should do because I do have fruit in the fridge. And I have the stuff to make a smoothie, so I need to do that. I've been bad. I gotta quit saying that I've been bad. I'm just saying as far as nutrition goes and the liquid goes and even the taking of my pills I've forgotten to take them. So I'm really screwing up, huh? Anyway, people, I hope you have a groovy day. And there was something that she said, but I forgot. I remembered it a second ago and then it's gone. But that's probably what it was, drinking enough fluids and my numbers being up for my kidney and liver function because I'm not drinking enough liquid. So it's important. And then if I'm not going to comply with the liquid, then I am hurting myself because the IV needs that to work, and the IV solution is what's causing the problem with kidneys and liver. Understand? So which is it I want to do? Do I want to just protect my kidneys and liver and get rid of? I am seriously thinking about it, getting rid of some things. Like I'm taking a pill every day. It's a little pill called Letrozole. That's the one that stops the production of hormones. And the injections stop the reception of hormones. Maybe I could take the Letrozole every day and get rid of the injections. And I know what they've said in the past is that there's that other thing. See, I'm taking the lesser of the two options that I was given because that first option, I listened to some videos on YouTube and somebody said that was worse than chemo, how it affected them, and she'd already been through chemo and radiation, and then they put her on that. So I don't know. I'm thinking about the other thing too is maybe I should go on to that because if I started wanting to travel and like the situation I've got now, I could have a doctor that gives me my prescriptions and I don't have to go in and get injections and I won't have to worry about a doctor in every place that I go. Now I have a kitty cat and I'm sweating. Listen, you, somewhere else, okay? Not right now. Yeah, I don't think you guys can see it, but there is a sheen on me right now. I'm sweating. I turned off the air conditioner because it was making noise, a distracting noise from my video. And I guess I left you with those thoughts. I'm not sure what I'm going to do. Because, what they do is they give you a list of side effects, right? And they just sounded horrible when I read over them. I'm going, no way am I going to do that. This talking about you having to be by a toilet all the time. Diarrhea being one of the, I'm pretty sure diarrhea is one of the side effects. No, can't be living with that crap, people. Notice the pun. I didn't mean to, but it was a pun. Crap. Anyway, I must go. I must go for now. And I think I got most of what my visit did. And you know, I forgot. They took my blood pressure, and I forgot to ask what it was. So it's like, okay. If I knew how to read those tests, I think they're on the portal. I just need to use, I don't know how to use that either. There's a way to go and look at your chart, your test results and all that. But before, when I looked, I couldn't figure out what it was, so that's why I've stayed away. I will write some questions down. I might call and talk to the doctor's nurse and see if there's anything else. I guess I got what's most important. There's a cat. She says she's most important. Anyway, you guys take care, and we'll talk to you later.